Good morning, everyone. I'm Kristin O'Malley, the President and CEO of the Cape Cod Foundation, and I am very pleased to welcome you to our third Connecting Cape Cod Community Forum. I hope you had a chance to review some of the housekeeping notes that are displayed here on the PowerPoint. And I'll also note that the session today is being recorded, and you should have seen a pop-up disclaimer about that. Because of the number of people on the call, we are asking that you remain muted, and please use the chat box to ask questions. We'll save time at the end for open Q&A with our panelists, and they've also offered to address any unanswered questions after the event, so we will send those out after as well. We'd like to extend a big thank you to our sponsor for today's session, Rogers Gray, a company that places a high value on the mental well-being of their own team members with employee assistance programs and mental health counseling for employees. Rogers Gray is also a big supporter of many charitable causes, and so we're very fortunate to have them as a champion for Cape Cod and for this session today. So if you're not familiar with the Cape Cod Foundation, here are some quick facts. And if this is the third forum you've attended, you could probably do this part of the presentation for me. But we were founded as a charitable organization 32 years ago. We started with one fund of $10,000 and now manage assets of over $85 million through more than 320 individual funds. Since our inception, we've distributed more than $80 million in grants and scholarships. We have a staff of 9, 13 board members, and over 100 volunteers that work with us mostly on the grant and scholarship distribution side. So with our 32 years of grant making and community experience, it was really a natural fit for us to quickly establish a community emergency response fund last spring to raise and distribute funds to support Cape Cod during the pandemic. Since March of 2020, we've raised over $3 million and have awarded over $2 million in assistance to more than 50 local nonprofit organizations. And it probably comes as no surprise that nearly 70% of the support has been to help meet basic human needs such as food, housing, utilities, and healthcare. For that reason, we chose to focus this first round of forums on basic needs, knowing that the issues are complex. And while we can't address everything in a 1-hour session, we do hope that these offer an overview of the needs and some ways to get involved. We also hope that this series will continue, giving us the opportunity to dive deeper together and focus more on solutions. One of the needs that has increased exponentially in the community during the pandemic is mental and behavioral health. For many, social isolation, feelings of uncertainty, emotional and physical loss, and the inability to access care have increased over the past year. In addition, unemployment, loss of housing, and food insecurity have added to the psychological burden of residents across every age and demographic, especially our most vulnerable. And we know that these impacts will be long-term. Fortunately for us, we have a number of local organizations that are working to address these issues, and are thrilled to have 3 of them here with us today. So I'd like to introduce Allie Anderson, who is the Chief Clinical Officer for Gosnold, Karen Gardner, who's the Chief Executive Officer for the Community Health Center of Cape Cod, and Cindy Horgan, who is the Executive Director of Cape Cod Children's Place. Thank you all for being here today. So I'd like to start by just asking each of you to give a brief overview of your organizations. So Allie, let's start with Gosnold.
We've got a large slide here. So Gosnold is a large continuum of inpatient, outpatient, and community care management. We are right here in Falmouth with our detox, 35 beds and 15 CSS beds, and then another 40 at our location in Bourne for CSS. We currently have residential Miller and Emerson programs that are located here in Falmouth as well for males and females, as well as a separate area for 10 women with their newborn babies. Sober living is also one of our continuum of care here. And then for outpatient, we currently have 6 outpatient sites: Stoughton, Centerville, North Dartmouth, Provincetown, Falmouth, and Nantucket. We have partial hospital programs at Stoughton and Centerville. Our specialty, of course, is dual diagnosis, although in our outpatients, we are primarily mental health. Really, the list goes on. Did you want me to go through all of it, Kristin? I don't want to take up too much time going through our services.
That's okay. I say just hit the high points, and I know more of this will come up as we get into the conversation. That's great. Thank you.
Yeah. So, and then we have recovery coaching and emergency room navigation. So we're located in Cape Cod Hospital, Falmouth Hospital, BID Plymouth, Milton, and Spalding Rehab, and we have people located, peer recovery specialists located there to help individuals who come into the ER needing additional resources. In the past, obviously, if people come in and they are intoxicated, they're often sent on their way with just a piece of paper and some phone numbers for them to call. But we currently have people embedded in there that help make those calls, help make those connections for those that are in need of services.
Great, thank you. Karen.
All right, good morning, everyone. I remembered to take myself off mute, yay. So we are Community Health Center of Cape Cod. Just very briefly overview, our mission is very simply to improve the health of the population. And we do that, I won't read this slide to you, but we do that through a whole host of means, including closing gaps for services for all of our population, providing total comprehensive care and providing care regardless of ability to pay and on a sliding scale basis if we need to. Our vision is to be the healthcare home of choice for everyone within our service area and to certainly encourage everyone to achieve lifelong wellness. Our programs and services, at least the primary ones, are listed here on the slide. We are very much about integration of services, primary care, oral health, behavioral health, how all of those impact each other. The little Cape Cod graphic will show you our locations as well as how many patients, and we tend to be concentrated, as you can see, on the Upper Cape with those 6 locations. All said and done, we have about 21,000 registered patients. And I will just spend a couple of minutes just talking a little bit more specifically about behavioral health in particular. As I mentioned, behavioral health is very much part of our integrated delivery model. We screen 100% of patients when they come to the health center for all health conditions, including behavioral health, but also gaps in services, any social determinants, information that will help us get to that mission and vision outcome. About 1 in 4 of our patients do screen in for a behavioral health condition, which is very telling in and of itself, I think. About 23% of our outpatient visits are all behavioral health and substance use disorder. I think for an outpatient health center, comprehensive health center, albeit we do have a robust behavioral health team. We have 3 psychiatrists on staff, really 4, but a couple of part-time, a psychologist, 8 behavioral health counselors, 5 substance use disorder technicians, and really most of our providers are also what they call waived or trained in substance use disorders. Behavioral health conditions are in the top 3 of the diagnoses that we see here at the health center. I think I'll leave it at that for right now.
Thanks, Karen. And Cindy.
Hi, thank you. So Cape Cod Children's Place, we're in our 25th year or going past that right now. We are a provider of early education and care, but we also provide a lot of other services. Our early education and care is focused in our Eastham location, but our other services are the First Steps Together program, which is working with families on the journey of recovery from substance use disorder. And that allows us to really cover the entire Cape and the islands. The second one is our coordinated family and community engagement grant opportunity through the Department of Early Education and Care. And that's for parent and child engagement. So a lot of the activities that are provided to really support that relationship within the family. Our third one is our Safe Child Communities Grant, which is in Stop Abuse for Every Child, which is the initiative through the Children's Trust. And those 2 grants together help us to support the communities from Barnstable down to Provincetown. And the last one that I'll speak to is our PC Plus, Parent Child Plus program, which allows us to provide early literacy and for parents, vulnerable families, so that we are really building the framework for school readiness. The mission of Cape Cod Children's Place is to build resiliency and strength and skills in Cape Cod's children and families. And our vision is a community where all children grow up safe, nurtured, and supported to achieve their full potential. The guiding principles that we use to do all of our work is from a formula called the protective factors. And those are building parental resilience, social connection, concrete support in times of need, knowledge of parenting and child development, and social and emotional competence. And that is how we do our work.
Thank you. Thank you, everyone. So we're going to jump into some questions here. Your organizations are certainly always on the front lines, and especially, over the past 16 months. So can we start and talk, Cindy, if you can start off and just talk a little bit about how the reach of your programs and services has changed during the course of the pandemic? What have you seen over the last 16 months?
When I described those 5 protective factors, which we really work hard in all of them, I would say that what changed for us is the biggest way that we saw ourselves supporting families was through the concrete needs, and really making that available to families. It was about food. It was about helping to pay for early education and care if you could find it, and doing those things there. In addition to that, we found that building those social connections through the virtual world became a way that we had never done our work before. And so that was a huge step for us. But those concrete needs, I think as of yesterday, we were at $39,000 in distribution of just Stop and Shop cards for families. So that was what changed for us significantly. We had for many years had a very small food pantry with non-perishables, but that shifted significantly once the pandemic came into play.
And did you find that, the connections that you already had with the families that you worked with, you became sort of that trusted partner and that place for them to go so that you could refer them to other services that they needed?
Absolutely. I think what I realized is on March 13th, everything kind of started to fall apart, or the world stopped turning. And what was really important to me as the head of this organization was, even though the governor didn't call me essential, I called myself essential. And I was committed to being in this building to pick up every phone call so that there was a human being on it. And we really have continued that philosophy from day one, that you never had to be put on hold. You always had a person to speak with. And so those social connections and just being the hub for those families, some people just needed to know they weren't alone in this. And that's what we were for them.
Right. That's great. Allie, what about with Gosnold? I know you've seen kind of an explosion and, sort of increased access on one hand, but also some areas where it was harder to access some of the groups that you'd worked with in the past.
Yeah, for us, we'd already been doing telepsych and telecounseling services. So obviously not at such a grand scale as when COVID hit, but it made an easy transition as most of our staff were used to utilizing it. The thing that we noticed the change the most was that in our outpatient services, our substance abuse programs saw a dramatic increase. About 30% of our SOAP programs, MID programs, and partial hospital programs saw an increase, as well as just our general outpatient mental health programs saw about a 50% increase. They almost doubled for people really needing services. And I think that just speaks to the isolation of people and the fear and anxiety that this pandemic really caused. It really exacerbated the substance use. We saw that here at the detox as people were constantly calling for beds. We did see the numbers of calls coming in increase as well, but not as rapidly as the outpatient services. I do think that telehealth has allowed for us to reach people that we wouldn't normally be able to reach in different parts of the state that are more isolated. It's allowed people the ability to reach out for services that maybe they feel there's a stigma with. Or that they have lack of time. People now who didn't have time because they've got family and work and they're constantly kind of trying to fit things in, they can now fit this in during their lunch break or during their work hours to do sessions with us instead of trying to find time after hours. I think that was extremely beneficial and helpful. The downside to this was really, unfortunately, our students in school-based programs. Because the schools had really closed up, they no longer allowed us in there. We are in 63 schools currently on and off Cape. We have clinicians embedded in these schools so that children can receive these services right during their school time. The problem with this became that schools were unsure of how they were even leading their models. And so it made it difficult for us to find times to meet with the students, especially with them now at home. Oftentimes, many of the reasons that students were coming to us for therapeutic services were due to family situations, sibling situations, and now with students at home and having to do telepsych at home, it made it quite difficult due to confidentiality. And many of the students felt awkward about continuing their sessions because there was that lack. They were at home, people could hear them, people could see them having these sessions. There really wasn't a place that was private for them. And so we had to find other workarounds for it.
Thanks. Karen, I know Community Health Center, you didn't necessarily see a shift in the demographics that you're serving in terms of clients, but definitely shift in the needs and expansion of the needs. So can you talk a little bit about what you've seen?
Sure. So similar to Allie and Cindy, we, like everyone else, experienced just an overnight change, 30% increase or so in the phone calls that were coming into the health center. Many individuals were challenged with healthcare providers or daycare providers or day treatment providers being closed. And we're just in that initial kind of scrambling and panic mode. So everything that came along with increased phone calls and increased new patient applications. I think through the pandemic, we've seen anywhere from 200 to 300 new patient applications coming to the health center each and every month. And part of that is medical, part of it's looking for behavioral health needs within that integrated model. But I certainly think that one of the most striking things that we saw was just the increase in disparities. Our population overall, and I think one of our complex care nurses really, her words to me initially just were kind of meant a lot. She said, you know, the patients that we care for, many of them were just hanging by a thread to begin with. And then the pandemic hit, and then the total bottom fell out. So I think those families, those most vulnerable, and for us, about 80% of our population is below 200% of the poverty level. Those families that are struggling, that disparity between populations and between the diversity within our populations got even more substantial. So screening and telehealth, as has already been mentioned, has made the world of difference. Not only video like we're able to do, not everybody has video capability, but the phone connections, the outreach calls, anything that we're able to do, phone, video, electronic health record communications, those connections certainly have helped. I think that during this time, even though there was our doors have remained open, we were able to do virtual group sessions for individuals as well. So certainly there are a number of services that, as has been mentioned already, that have helped meet the demand for services. I'm not sure that it's going to be so easy to reduce those disparities over the next 15 months. It took, we very quickly lost ground in closing those gaps, and we've got a lot of work to do to get back to where we were.
Thank you. So you've all talked about sort of this, shift to telehealth and sort of the hybrid model. And so can we talk a little bit more about that? I'd love to kind of know more about what your plans are moving forward. I think each of you spoke to kind of the positives and negatives of that kind of hybrid programming. But, has it shifted your thinking in terms of how you are delivering programs, and what does that kind of look like moving forward? And, are you starting to see a little bit of Zoom or telehealth fatigue, as we're all 16 months into this now? So Allie, do you want to start with that?
Yeah, most definitely. We have definitely seen a shift. I think what initially started out as an overwhelming help to some of the fear and anxiety, we've now seen a lot of people really requesting that need to be back in person and that connection. So we have moved back to that hybrid model for many of our programs, and we'll continue to do so. But I think to your point, now that we've gone that route of the tele, I think that this will be the new normal, is that we will continue to do hybrid from here on out, because it reaches a population and serves a purpose for many individuals that have had a lack of connection to services, or again, because of that stigma. But for many of the patients, especially in our substance abuse programs, they really felt the need and requested that need to have that in-person connection, to be there sitting with someone and sharing stories and talking about things. So for many of them, we have heard that they have had Zoom burnout, and I can't deny them that. I mean, 3 or 5 hours a day on some of our programs is a lot. That's a lot of Zoom. So yeah.
Thank you. Karen, how about the health center?
I'm sure very similar to Allie's comments. You know, one of the elements that are foundational to the health center is being able to provide the right care at the right time to the patients when they need it. And certainly this challenged us to that highest degree to be able to do that. We too had been, I won't say dabbling, we had been doing pretty deliberate telehealth prior to the pandemic, but then immediately transitioned to 100%. Now we're getting back to that hybrid model. And certainly there are tremendous benefits, engagement being one of them. Now patients don't have to just come to a health center. They can connect via text message or message through the electronic health record, or video chatting, or a whole number of ways they can connect with the health center. What we are finding though is that there's a little bit, Zoom fatigue is a part of it, but it's more, well, it's more expeditious for us to do things this way, but they may not be getting the testing that they need, that in-person testing, diagnostic testing, chronic care testing that should happen. So I think, again, we're going to have to work on that as a challenge going forward, but definitely this hybrid model is here to stay for sure.
Cindy, how about for you?
Well, of everybody on this panel, I probably was the most resistant to working from the world of technology, and yet I've grown and I've developed those skills. And so we did transition to Zoom, and because we still had a mandate from all of our funding sources to provide parent-child engagement, and they really embrace that. There is absolutely Zoom fatigue when you've got a toddler and a parent trying to do a yoga class together, and they're kind of like done with that. I will tell you, I was so inspired by the engagement for some of our for all of our parent education in our support groups for individuals. We saw really vulnerable families that had always been difficult to engage, really participating and really embracing this opportunity. So as I move forward, we will be doing a hybrid model, especially on the parent education and the support groups. And we're just trying to put that together. I'm actually going to be in Mashpee with my first initiative working on this in July, and I'm excited for that opportunity to be able to do it from that format. Again, we had all of the sort of fear. I think we were hearing about Zoom bombs and all of these things, and we had all of this, and we got really good at setting up a team response to it. So we had somebody that was monitoring all of the comings and goings on the Zoom while one of us was presenting, and we really created a really nice rhythm. It also expanded our capacity to bring on some of our people that have always wanted to be a part of our work but couldn't, so they came on as that second person. So I had board members stepping in. I had people that they would never in their role here be able to do that. And it really helped us all to have a deeper understanding for what we all do. But there's the level of fatigue, but it absolutely, I think, was a lifesaver for our families using technology.
I think most of us were resistant, so in the same boat there, Cindy. Still learning, right? So we all know the power and the importance of partnership and collaboration. So I know, we've heard so many amazing stories, especially over the last 16 months of how partnerships and collaboration have helped either, an existing partnership or a new partnership that has just made the difference for you in terms of the services that you provide your clients. So Karen, was there kind of one partnership that stands out? I'm sure there are a lot, but just talk about one.
Yeah. Oh gosh, I don't know if I can limit it to one. Certainly, I've been totally blown away by the level of partnership and commitment from so many organizations in the community. I'll have to just do two. The first one certainly is our, Cape Cod Foundation, our funders, our supporters. Right away, everyone was at our doorstep, at our phone, at our email. What do you need? How can we help you? Sort of that no questions asked. We know that healthcare is going to be a need. We know that PPE was like huge in the news everywhere in the beginning. We know that those shortages are real. We know that you need a workforce, or you have workforce challenges. How can we help you? So totally blown away by that level of commitment and organization, quite frankly, of our funders and those collaborative relationships. The second to that really is how all of the human services providers came together in a county-wide coalition. Whether it be, and I'll just give Senator Sear a shout out. Certainly, he's done a lot in the community to make sure that our voices are heard from a vaccination standpoint, a testing standpoint, really assembling the local chambers, other nonprofits, health departments, fire and police, and what have you, to come together and get homebound residents taken care of, for example, and other things. So, we see those flags in people's windows or on the lawns. We're in this together. Totally, I have felt that across the board on Cape Cod.
Thank you.
Mm-hmm.
Cindy, how about you?
Well, I would say everything that Karen said, I would have said just as well. But the other piece that, because I don't want to repeat Karen, but that was my experience as well. I do want to just identify one organization or one individual. Matt Cole from Cape Associates really stepped up. We've had a wonderful relationship with them for years, but Matt really heard when I talked about how many families were going to fall through the cracks when it came to paying for early education and care. And he really took it to another level. And he and I really talked through what that would look like. So he partnered with the Brewster Baptist Church, and we came up with a fund to really help families kind of get over this really crisis time financially. And so in addition to what Karen said, and those were all my experiences, which were phenomenal, I would love to give a shout out to Matt.
Thank you. And Allie, how about with Gosnold?
Yeah, we, similar to both Karen and Cindy, we had an overwhelming outpour of people offering us PPP, which was greatly appreciated. I mean, right from the get-go, we were able to get the N95 masks for all of our inpatient staff, which was truly marvelous, and I think really cut down on the number of positive cases that we saw here. In fact, we were able to give N95s to not just our staff, but also to the patients for patient safety as well. And I think that was a huge piece to us being able to stay open and continuing to be able to meet the needs of the community in having that resource. And we've worked really closely with some other companies as well, like EDI for electronic digital imagery, and they've really that program and that support has been exceptional with a number of our patients being able to provide this kind of connection and resources and treatment and therapy in this other kind of new way of tele. So those are just kind of a couple of them for us, but obviously we rely on the community for resources and support, and our counterparts really to be able to service all of the patients and all of their needs. And I think we really came together as a community to really help and find support, because I think many of us have struggled with staff retention during this time. It's been extremely difficult due to due to people having to stay home with their children because children were no longer able to go to daycares and schools, because people had COVID themselves, because they had elderly family members that they needed to take care of, or just out of fear and anxiety themselves. And so I think, working as a team and a community to help find these additional resources and meet the needs of patients where they're at was truly remarkable.
Thank you. So looking ahead a little bit, I think we've all heard that there's some federal and state dollars that have been allocated towards mental and behavioral health, yet I think there's still a lot of unknowns as to exactly how that will roll out, and things are kind of coming out slowly. But as a community, what should we be thinking about? What's the best use of these resources if we're trying to think about sort of longer term systemic solutions to some of the challenges that we've seen? What should be our plans? Just sort of blue sky a little bit here for me. Cindy, do you want to start?
Sure. Well, as you said, we hear of that money, and that's what we've done. We've heard of that money. So thanks for reminding us. I would say that the model that the Cape Cod Foundation with the COVID relief, and what is so wonderful about the way that that rolled out for us, is we were able to identify the needs that we saw as an organization and meet those needs for families. So I know that many organizations saw this, and we were able to be unique to support the needs of our families. So ours went towards both food and scholarship, as well as looking at a program that we have called Sensational Kids, which is really addressing some of the behavioral challenges that children have. And so we were able to be unique in supporting our community that way. I think as this money comes forward, in addition to looking at that, just your formula was ideal, and it should be replicated for others to follow. But in addition to that, we need to also be paying attention to, as Allie was saying, about our workforces and how this money, if it comes this way, we need to really start to really evaluate how we value human beings in work and paying a living wage. And I can go on and on about that, but that's how I feel about it.
Thank you. Allie, how about you?
Yeah, I'll just piggyback onto Cindy, and that is, being able to support our staff as well and the work that they do, because we are essential staff on our inpatient, and so we need to keep running in order to keep things going. There's a pandemic going on, but there's also an epidemic going on as well around substance use, and so I think we can't deny that our staff need to be here, but there's a fear with that too. And how do we keep them coming in and keep the doors open? And I think that is investment in the staff, education for the staff, making sure that they are the PPP, that they are protected, and mental health days for them too. I mean, when we're short staffed for workforce, that the ability to take days off really decreases. People are all hands on deck. And so, we kind of see now that things are relieving, there's some breathing, and there's the need to, take the days off, get some time away, spend them with your families. But I think it's, I don't think that COVID is ever going to completely go away. And I think that we just need to continue to manage this and be proactive. And so we definitely need, the PPP was, without it, we would certainly be no longer. I think that was a great support and help and need in keeping us able to retain our staff.
Yeah, I mean, you make great points, because it's a cycle, right? So, I mean, if you don't have the staff and the people to fill the roles, yet we're seeing this huge increased need, how can we ever sort of match the capacity with the resources, right? And so it really is the people power. And so making sure that we're supporting people, in their roles and to move into different roles and things like that is a huge need. Karen, what about from your perspective?
So July 1 is the start of our new fiscal year, and we're still working through budget, but we're budgeting for a 25% increase overall in our operating budget this year. And that really is for everything that we've talked about in terms of increasing the capacity and the workforce and everything that we need to do based on this really overwhelming increased need that we're seeing. We were a recipient of federal funding through the American Recovery Act, and certainly that helps. It's not going to cover that 25% budget, but it will allow us to hire another physician and do some of those incremental things. At the state level, I think that Massachusetts, our legislature, our reps, everyone, the foundation included, have done a lot of work to educate and advocate, and rates are getting a little bit better, at least speaking personally from the health center perspective. We keep talking about seeing parity between mental health and behavioral health payment rates in medical, and we are not seeing that parity yet. And I think as a result, we're going to continue to be challenged with recruiting and retaining behavioral health providers to do what we need them to do. Most every counselor that I know is probably working at least 2 jobs because it's that field, as much as they love it and very mission focused, they can't make that living wage and support a family. So that parity conversation is hugely important for us. I think as we look beyond, and I know I sort of superficially glanced at some of the questions, which I'm sure we'll get to, but looking beyond it, we need to take a deeper dive into what's driving this need and this continuous increased need. Those social determinants, and housing always bubbles to the top of the list. And I couldn't agree more that housing, stable, affordable housing does have an impact totally on mental health and medical conditions across the board. And really, until we're able to do more continuously in that area, it's going to get tough. It's going to be hard to get to a healthier place overall.
Yeah, I think that's a great point. We always talk, and why we called these forums Connecting Cape Cod, right? Because you can't really tease apart one issue. We've talked about food security, we've talked about housing and homelessness. This is our third, and all of these things are connected. And, so it kind of leads into the next question. All these folks are on the call for different reasons, but everybody wants to get involved and help. So besides donating to specific organizations, what are some other ways that people can engage in these conversations, whether it's through advocacy, or are there local community groups and collaboratives that are working on this that people can get involved with? Karen, do you want to start?
Sure. As you mentioned, Kristin, I do think that education, these community forums do go a long way to just making sure that everyone knows what the needs are, but also where the resources are and where they could be. I think that Cape Cod, our Barnstable County and the islands are a very rich source of expertise. And I think the more we educate and engage everyone, that expertise can be leveraged and we can all get to a healthier place. So it may not always be financial resources, but advocacy, volunteerism, just lending expertise on advisory board capacities and other things does go a long way. And then, that term of supporting local, we hear that a lot in retail and super important. Also important in healthcare, support local, use local healthcare resources that we have available, and we leverage some of that funding to spread out to increased programming, for example.
Thank you. That's great. Cindy?
Thank you. And I would say that the place that really the light has been shown on this, and Julian Sear and Sarah Peak and Sue Moran have done an amazing job, is looking at the field of early education and care. And that was a huge factor in what created some instability here for us all, because we kept our children home. This has been a field that has been in crisis for as long as I've been doing this, which is for a lot of years. And now it is really highlighted there. There's an initiative right now called Common Start that has been working really hard to educate and to put forward legislation that looks at creating high quality, affordable in a workforce, to pay a workforce a living wage. It is really important that everybody, even if you do not have young children, this is impacting your world. And I would encourage everybody to pay attention and Google Common Start and be aware of how critical and how fragile this is in our community and in our society. There's an event next week, and I don't know the date, but with a film called No Small Matter. And I think it's really important that as many people as we can get to view that, because we all, regardless of our age or our family dynamics, need to be addressing this issue. And again, I am so grateful to Julian and Sarah and Sue Moran for all that they have done during this time around this issue.
Thank you. And we can share, I mentioned that we'll send out some resources and things after. So I see a lot of folks have put resources in the chat that we'll include, and then we'll also reference the event that you just talked about, Cindy, there as well. Allie, anything you want to add to this?
Yeah, I think the other piece that people can do, and just speaking of Julian Sear and Sarah Moran, is just really being able to speak up and go to legislation and lobby and help support in any way that they can about these topics and these things that we are discussing. Because we can certainly talk about them as a company and as an organization, but I think it's another thing when there are people from the community demanding these needs and saying that they need help and support. It speaks volumes when you have someone else besides the larger companies and organizations doing it. I think it really adds extra voices to it, and they're able to really hear where the needs are more so. So I just, I encourage everyone to reach out, and it doesn't have to be going in person to lobby. It can be emails, it could be, short calls, but it does mean something, and they do hear you when you call, and they do listen.
So on that note, I think a lot of times people are a little nervous about, like, I don't have the right information, or what exactly am I saying, or what am I sort of advocating for? So do any of your organizations sort of provide that type of information to guide people so they know, okay, this is what I'm going to say in a letter or an email or a phone call or whatever? Like, you're all nodding. So yes, how would people access that information? Just contact you, or do you have it on your websites? Cindy, I'll start with you first.
Sure, you can absolutely contact me. And what I'd probably be doing is walking you through the Common Start website, because it's all in there about how we really have these conversations and how we have them at a way that people can hear it.
Allie?
Yeah, they can email me directly, but I think that's a great idea and suggestion, is to put it on our website for just ease of use and kind of some of the important topics that people could reach out about. So so I'll actually take that idea and speak to our website people. Thank you.
Perfect. And Karen, same. Should people contact you, or do you have someone?
Same here. You're welcome to contact me. I also see one of my colleagues, Chris Ellis, our advancement director, in the audience, if you will. You're welcome to contact him. Information is on our website, and I know that you will probably be sending information out after, and I'm happy to include some of the detail of those advocacy points and bills and things that are out there now for consideration in the upcoming budget.
Perfect. Thank you.
Mm-hmm.
And just I'm going to jump over. It's 10:15, so I know there are some questions that have popped up, so we can take a look at some of those. And so if you do have a question, please remember to type it in the chat box. We're just trying to keep folks on mute because of the number of people on the call. So I know that there was a question about, how do you define vulnerable population? So when we're talking about vulnerable populations, what does that definition mean to you? Karen, do you want to start?
Sure, I'm happy to start. So in a number of ways, usually based on screenings, and that screening could include income, poverty level related income. It could also include significant gaps in services, individuals that don't have ready access to food or housing. They could be homeless or at risk for being homeless, but it's all based on the individual screenings that we do for that population.
Thank you. Any other additions to that, Cindy?
Sure. I think when I consider vulnerable populations, it's individuals or families that engage with us that are either lacking supports or have not found the ability to identify the supports that may exist within their circle. And so we're that first reach for them.
Thanks. Allie?
Yeah, it's pretty much the same. It's anyone who is without resources or unable to reach those resources, or someone who is in a population that is at a high risk population.
Thanks. Okay, I'm just, sorry, scrolling through the questions here. So someone had asked, heard that there was a wait list for mental health services and sort of, how do you deal with that, right? We talked kind of about capacity and how do we make sure that we're matching up with the need and the resources available. So we know that that's a challenge, but is that the case? And then sort of what happens in that situation and what does that waiting time look like? I don't know who wants to jump in. Feel free to just start talking.
I can go ahead and start. So there's no question that the demand for mental health and behavioral health overall services outweigh our resources, and there are waiting times. So the way that we deal with that is making sure that we are talking with individuals and sort of triaging. So if someone doesn't have access to go elsewhere, to be referred elsewhere based on insurance, then we will do everything that we can to get them in at the time that they need to be seen based on that level of clinician's assessment. What we also have started doing is training our medical providers in the collaborative care model of treatment. So most of our primary care, our 13 primary care providers, are trained in psychiatric medication management and managing some behavioral health conditions, including substance use disorder, to kind of relieve the pressure on our mental health resources. And that has gone a long way. And the third thing that we've done is we've started working with an organization called the Maven Group, and they are an all-volunteer organization. And it gets back to that, what else can we do? Lending expertise. But they have a number of volunteers, including behavioral health professionals, that will do non-patient facing curbside consults with clinicians to kind of, again, facilitate and take a little bit more pressure off of the behavioral health clinicians. So that's what we're doing.
Thank you.
Mm-hmm.
Allie or Cindy, anything to add to that?
Yeah, we have mental health, it has a large wait list for us as well. And so we are just trying to triage as well and figure out and kind of expand on our initial kind of discussions and questions with patients to see what other services we can provide to provide kind of a wraparound until they can get to those appointments. So we have, CSP, REACH, community partnership, coaching, and many of those services are insurances are provided for those. They pay for that service. So we are just really trying to work with individuals, and even though they may not be able to get the counseling, trying to find other services that might still be beneficial to them and give them a little bit of help and support. And again, we're reaching out to our counterparts in the community too, if there's going to be long waits and services to help redirect people to where they might be able to get something sooner. So, but I know that many people right now, there's a wait list.
But it's a good strategy to keep them connected and engaged, right? Because they made the step of reaching out and asking for help, right? And so trying to sort of wrap around them and make sure that they stay connected to you.
Yeah, following up with them regularly, even if they're on the wait list. We've been trying to make a point of at least touching base once a month to check in with people. But hopefully, May, lots of social work graduates coming into the field. So hopefully have a nice regrowth.
Cindy.
And I would say we're not a mental health provider. We're extremely aware of the wait list, but I do think that our services and our resource and referral and just being really someone you can talk to and triaging with our support groups and our parenting groups sometimes can help in those real crisis moments to just let them know they're not alone.
That's great. And for all, the folks that are on the call and just in the community, I mean, again, it goes back to those partnerships and sort of that information exchange, knowing who's doing what. So when you are that trusted source, how to connect them to those resources.
Yes.
So there was another question about, and we talked a little bit about the importance of supporting staff retention, staff support. So can anyone talk a little bit about what types of things have you been able to do as an organization to support your teams? It's something we're all struggling with, right?
So this is Cindy, and as we were beginning to reopen our early education programs, we realized in order to do this successfully, it really had to be staff driven. So we really worked hard at creating a lot of prep time and talking through and strategizing with the staff and gradually opening up that way. And we were really successful in our reopening because of the preparation that we put in to that. And we're extremely aware of the fatigue and mental health of our staff and looking for small ways to celebrate them in any way that we can.
Great. Karen?
Similarly, I would say that one of the most important things that we were able to do is just flexibility. Same thing that we would do with patients, kind of meeting them where they are. All of our staff had challenges with daycare providers and technology and different challenges. So our ability to remain flexible and work within remote schedules when we could was huge. We've also really made a deliberate attempt to focus on a long-term plan for salary structure. And we just super believe it's important in the long run to be competitive as a health center there. And then I think the third thing is just to remember to breathe, have a little fun. In our world, our health center healthcare providers love food and love challenges. And so little mini competitions and fun things along the way to just build that culture of we're going to get through this, positivity. That positivity thought just goes a huge way.
Yeah, completely. Allie, anything to add to that?
Yeah, food is a big promoter. So yeah, I think it goes a long way to just tell your staff how much they are appreciated and to really acknowledge the wonderful work that they've done. Obviously, monetary appreciation is always welcomed as well. And so we've tried to utilize our PPP in the most beneficial way too, for those that are providing care, either tele or in person. We've really tried to support them that way, but we've also been in the initial stages when people needed to be at home in childcare, we really tried to be as flexible as possible. And we have really wonderful staff who understood that some people couldn't come in and some people who could do their jobs at home in hybrid and others who just couldn't, but we needed to still support them and work as a team to get the job done. And so I think it's, for us, it was really all about staff appreciation and really kind of those constant reminders of telling them that they're doing a good job.
Yeah, we've got a couple more minutes, so I want to end on a positive note here. So if you could give kind of your top silver lining, COVID silver lining, what would it be? Cindy?
Deeper relationships with already well-established friends. I was raised up by the giving of our community. We were.
I think that's definitely a consistent theme we've heard. Not that we, want to have to go through another pandemic to all come together, but definitely seeing a whole level of community partnership and collaboration and support, which is amazing.
Yes.
Allie, what's yours?
I think the silver lining is being able to reach people that would never be able to utilize these services. So I think in some ways expanding on the telepsych has really been beneficial and opened our eyes to helping those, because I think that while we want to say that we're stamping out the stigma around mental health and substance use, we are not there yet. And I think, just the increases in our programs go to show that there are a lot of people out there and a lot of need. And when you can make these services available at any time and anywhere, you're going to see that people are interested. And I think that's the piece to it, is that we've been able to open up an avenue that people haven't been able to utilize before, and opening some doors for them to get treatment and support, which I think is wonderful.
Karen?
Yeah, and it really, hands down, it's the collaborations and the teamwork. I couldn't agree more there. What we've all been through together, I think will frame some of the work that we can do going forward. That's huge. If I have to say one other thing, it just some of the advances in technology. I think technology is an area that we all can take advantage of to solve some of the workforce and other issues that we're challenged with. So I think that the gains that we've been able to make have been huge, and we just need to keep going.
Thank you. All right, so I am going to get everybody done on time. So I just want to say a big thank you to our panelists, to our sponsor, Rogers Gray, and to all of you for joining us today. We hope you found this informational and educational. And while we have challenges ahead of us, we know that, as we were just talking about, our community will pull together like we always do. And as mentioned, we'll send along some follow-up information. If you have other questions, post them in the chat quickly before you jump off, or send a follow-up email to us, and we'll make sure that those get answered by the panelists. So thank you all, everyone, so much for being here today. And we're going to take a little summer hiatus from the forums, but we'll be back in the fall. So hope everyone stays well. Thank you so much.
Kristin.
Thank you so
Thank you.
much.
Bye, everyone.
Bye.
Bye.